As we have said for many weeks now, one of the most critical battlegrounds in our fight against this virus remains in our long-term care facilities, specifically nursing homes. Over the last several weeks, the Georgia National Guard has worked closely with public health officials and the Department of Community Health to test nursing home residents and staff. Right now, 48% of all COVID-19 deaths in Georgia are connected to long-term care facilities. The earlier we test, the earlier we can intervene and try to prevent severe outcomes. As of yesterday afternoon, we've tested 66% of nursing home residents and 36% of all staff. That is in addition to the nearly 2,000 infection control missions conducted, with more than 900 facilities receiving 2 or more mission visits. This is a top priority for us as we continue to work around the clock to protect our most vulnerable, and we will continue to do everything in our power to keep these Georgians safe. Since we began the rapid increase of our testing capacity in mid-April, we continue to remind the public and those in the media, the more that we test, the more cases that we will see. That is especially true with our efforts to test high-risk populations like we've been doing in our nursing homes. The multiple public-private partnerships around testing that were created in a matter of weeks to fight this pandemic have exponentially increased our testing capacity. But the nature of COVID-19 testing and reporting can sometimes lead to delays in mass reporting of results. Dr. Toomey and her team at Public Health continue to work with our private sector partners to streamline these new processes and ensure our testing data is timely as well as accurate.